I want you to, for the first time, create a return on investment based marketing budget. Many hospitals, healthcare manufacturers, practices have no real budget at all. They just simply invest money on marketing to the degree they feel comfortable with. But I want you to actually stop and build a marketing budget and build it based upon return on investment goals. Let me explain. Many people use what we call the objectives budget. In advertising, that's very common. I want a certain number of rating points. I want a share of mind. I want to advertise more than my competitor. So those are all objectives-based budgeting. And that's one way of doing it, and it is valid. The second methodology is the percentage of sales method. And that seems like that would be a reasonable idea. In fact, it's still taught by people who should know better. But corporate America, by and large, gave up on percentage of sales many years ago. Why? Well, it turns out that percentage of sales means that you're going to invest in marketing on a percentage on how well you're doing. So how much I invest depends on how much I make, which depends in large part on how much I invest, which depends on how much I make. Do you get it? It's a paradox. There's no independent variable. They both rely upon each other. Also, if you have two organizations with exactly the same sales under the percentage of sales budget, you would assume that that would mean, in fact, they're going to invest exactly the same amount of money in marketing. Well, but what if one of the organizations is located in Manhattan, New York, and the other is in Manhattan, Kansas? One is very, very large and has, or rather one has a large number of patients to work with, the other has a very small number of patients to work with. Media costs are different, objectives are different, one may want to double versus the other. You can see that an arbitrary percentage of sales doesn't really make sense. The next way of marketing is probably the most common. This is the strategic wild-ass guess budget, where we're just going to make something up and hope that's the right answer. Probably not the best way of doing it, but probably the way most people do their budgeting these days. Similar to the swag budget is the all-you-can-afford budget. Well, this month I can spend this much on marketing. Next month I can spend this much on marketing. And the problem with that is it's not really a budget. It's reactive to what's going on in the marketplace in your practice. So again, it's not a very good way of budgeting, though a lot of people do. So again, I alluded to return on investment based budgeting. And as I mentioned a minute ago, return on investment budgeting is not the only way to budget. It's one way. Sometimes we recommend looking at objectives budgeting, percentage of sales, return on investment budgeting together, much like an appraiser appraises a house from different viewpoints. So it's not the only way to build a budget, but it's a good place to start. So let's take a look at this a little bit more deeply.